having this discussion with us, and they will be giving us more information. So without further ado, I would like to welcome the panelists and also introduce them. So I will start off from my left-hand side. I am joined by Mr. Barnabas Itula, who is the Acting Deputy Director of Operations for the Pharmaceutical Services Ministry of Health. And next to him is Ms. Anna Shimbulu, who is the Senior Medicine Safety Pharmacist for the Namibia Medicines Regulatory Council. And next to her is Dr. Ridima Mpande, who is a medical officer in the Internal Medicine Department for the Ministry of Health. And last but certainly not least is Sister Paula Kanjeke, who is a senior registered nurse for the Ministry of Health at Windhoek Central Hospital. Very welcome to our panelists. Thank you so much for joining us and availing your time to speak about this topic. So just to engage you, the medication safety has come about as a result of a campaign that is taking place this week, and it's called hashtag the Med Safety Week campaign. So let us start with you, Ms. Shimbulu. Please enlighten us and engage us and give us more information as to what is the Med Safety campaign, when was it established and how, and what is going on with the Med Safety campaign as it stands. Over to you.
Okay, thank you very much, Ms. Shiwetha. So hashtag Med Safety Week is a social media campaign which is commemorated every year in November. And it's an initiative of the Uppsala Monitoring Center, which is the WHO coordinating center for drug safety across the globe. So this campaign is meant to pull together national pharmacovigilance centers and regulatory authorities all over the world to come together and provide more information and awareness on medication safety, as well as the systems that are in place in the respective countries to monitor and report. So this year, this is actually the 7th campaign that is taking place. And as a country, Namibia, this is the 3rd time we are joining. And we are excited to really be part of it and provide more awareness to the general public.
Okay. Thank you so much, Ms. Shimbulu. So with this campaign, we have learned that the selected theme is how patients and healthcare professionals make safety work. So with this theme, will you be able to share with us exactly why this theme was chosen? As you've been mentioning, there's pharmacovigilance. Would you be able also to explain that term for us so that we understand what it is about?
Okay, so this year's theme is basically providing more emphasis on the critical role that patient and healthcare workers play in contributing to the safety monitoring of medicines that are used. So the patient being the end users of this medication, and definitely the respondents when it comes to therapeutic effects, and also the adverse events that they may experience. And the healthcare workers, basically the overseer of the use of this medicine in terms of prescribing, dispensing, administering, and monitoring the effect that is expected, as well as the adverse event. So together, the two stakeholders play a very critical role in providing feedback and information on these adverse drug reactions or side effects to the drug monitoring centers, and therefore contribute to the global safety of medicines. To answer your question on the concept of pharmacovigilance, this basically entails all the activities that involved, firstly in the detection, the assessment, understanding, as well as prevention of any adverse events that occurs after the use of medication. So as the terminology entails, it's talking about pharmacovigilance. So it's basically being vigilant of the use of medicine.
Okay. All right, thank you so much for providing us with that background. And I think it's what you mentioned very important is that there are certain activities within this pharmacovigilance process, and it seems that every healthcare professional has a role in it. And you mentioned some very interesting terms as well. So just to give you a chance, Dr. Mpande, some of the terms that were mentioned by Ms. Mbulu by Ms. Shibulu are adverse events, side effects, as well as adverse drug events. So perhaps then you can just break that down for us or give us basic definitions for those terms.
Okay, thank you so much. So when we talk about a side effect of a medication, we are talking of an unintended effect of a pharmaceutical product, and it's mostly when it is used at the intended doses, that is the human safe doses, but then you get an unintended effect. But the most important thing when we talk of a side effect is they are tolerable, so the patient is able to tolerate them. So a good example of this is when we look at the TB medication, some patients may see an orange discoloration of their urine. So it is a side effect, but it's something that they can actually tolerate. Then when you look at adverse drug reaction, so this is a still unintended effect of a pharmaceutical product, but now it's still at the appropriate doses, but it is noxious. So it means there is a harm that it can actually cause. So a good example is when we have drugs that we use to thin the blood for patients with clots, called anticoagulants. There are some times when these drugs can actually be harmful to patients, and then they can end up bleeding, you know. And then there's also a terminology you also mentioned adverse drug event. So adverse drug event is an untoward or something that is inappropriate. So this is now when a patient is actually on treatment, and then we see that the patient can then react to medication. For example, is when you have a patient that is on insulin, a diabetic patient, if they, maybe for some reason, did not really hear the doctor's instruction well, and they give themselves a higher dose of the insulin, then they can actually have an adverse drug event. In this case, they can come back with very low blood sugar levels, and that is happening while it's in the treatment phase of the patient. So it's an inappropriate reaction, but then the dosage that was given is a little bit different from when we compare it to the adverse drug reaction and the side effect. Yeah.
Okay. Thank you so much, Dr. Mpande. I'm sure you've broken it very well down for especially the public who doesn't have any idea, and this might sound like Greek to them, but that's why we're here today, so that we can explain it to them in layman's terms, but they still have an idea as to why medication safety should be discussed, why it's important, and especially also for this campaign, the Med Safety Week. But before we can play a video that was shared with us for the Med Safety campaign, Dr. Mpande, I just want to ask you, how do these ADRs affect the patients when they experience them? Just please enlighten us a bit on that.
All right. So yeah, thank you so much for that question. The effects of these ADRs can actually be broken down. So we've got mild side effects, we've got moderate side effects, we've got severe side effects, and then we've got lethal. So when you talk of mild side effects is the example I gave for the TB medication. So this a patient can actually bear with. So there's no need to discontinue the medication. There's no need to adjust the dose. But then when we talk about the moderate side effects, yes, the patient can tolerate to some extent, but then if it goes overbound, then we can consider changing. So a good example of this is the oral contraceptives, you know, and most of these can actually cause blood clots, yes? And some we have seen where patients come in with complaints of weight gain. So in such instances, we can consider, stopping, or for some, it can be just a reassurance. And then when we talk of the severe side effects, this is where now we need to address the drug itself, and we need to look at the dose, yeah? And there is actually a need to discontinue on this treatment. And then a classical example, which probably will elaborate later, is antihypertensive that can actually cause angioedema, which we have seen many a times in the patients in the past few months, So that has to be stopped. And then the lethal one is where now it's life-threatening, where a patient's life is at risk, or actually it can claim a patient's life. So for example, when we talk of paracetamol overdose, so the effects are, if not treated, very lethal to the patient. So that is a brief breaking, of the effects that can have on the patients. And with adherence issues, the patients can then not adhere to the treatment, and that means the intended effect of the medication is not being executed at the end. Yeah.
Okay. Thank you so much, Dr. Mpande, for that. So right now we're going to showcase a video in celebration of the hashtag MedSafety Week, just for the general public to have an idea what this is about. So here's the video. Okay, thank you very much for that video. It's very good to see that this content is available for the general public, and now that they have seen this animation, then maybe then they can also understand better why medication safety is important, and as you've also mentioned, the reporting of these adverse drug reactions. So just to build on some of the examples that were shared with us by Dr. Mpande, I'd like to hand the floor, kick the ball over to Sister Kanjeke to just explain to us or enlighten us that from your experience as a nurse for so many years, can you perhaps share with us some examples of adverse drug reactions that you've come across, and also how commonly they occur? So Sister Kanjeke, over to you.
Good afternoon, everybody, and thank you for the chance. Actually, I'm on the referral hospital working in Windhoek Central ICU. Most of the side effect or adverse drugs reaction, we only used to receive those who are most of severe and life-threatening. For example, a patient is he already started from either from the clinic or the other hospital, then referred to us. He already came with a bad situation when he's really either come with a shortening of breathing, he come with a angioedema, is followed by the for example, Doppler, which is an antihypertension medication, which we really used to see most of them, when they come to us, they either need tracheostomy because they started with overreaction and severe edematose, which is the obstruction of a respiratory system. So it is really, I'm really happy to be part of this panel today to give information to our nation. So we need to be really be careful to each and every medication or drugs which you are used. We must know what is the side effect, why we also getting that specific medication. I'm happy that most of our medication have got a pamphlet inside which is telling us if you take this medication, maybe you can come up with this reaction, maybe for example, dizziness, severe headaches, chest pain, and all that stuff. I just want to say to our nation that they must really be vigilant to all drugs which they are taking. They are free to ask the doctors what this medication for and of is any side effects, so I must be aware before it will become worse. As I say, I'm on the referral hospital where I used to get a severe case where the people can't handle at the small hospital or all that stuff.
Thank you so much, Sister Kanjeka. I think it's so important to know that even within the hospital setting, this can occur, and you as a healthcare professional have been able to attend to them and to be able to brief us with this information. But just before we can continue, I'd just like to remind our audience which is joining us this afternoon that if you're not in front of your TV, but you do have access to our Facebook and YouTube page, you are welcome to go to the MICT social media pages and then just put your questions there or give your comments there, and then we will be having a slot where we'll be able to take any information that you want to share with us or any questions that you do have. So this panelist is very diverse, like I've said, and Ms. Shimpulu has shared with us that within the pharmacovigilance cycle, there is a certain activity. So we've got the prescriber, then we've got the dispenser, then we've got the one doing the monitoring, and then we've got the supply chain as well. So starting with you, Mr. Itula, coming from clinical practice and then also now in supply chain, what do you think is your role as a healthcare professional? What is the role that you play in medicine safety? And can you give us some of the examples that you, or some scenarios that you carry out in your day-to-day to carry out this function of ensuring medication safety?
Thank you, Ms. Shweda, for the opportunity, and also to the general public out there. This is a very, very important kind of activity we are now trying to undertake to educate the population. And this education does not just go to the general public, I think also to the healthcare itself and people who are involved. I'm a pharmacist by profession, 13 years now in the profession, and I've been working in different sectors, but normally on a clinical settings. So as a pharmacist, we are the last person in every setting whereby when a patient comes, they start with the nursing process, go to a doctor. We are always the last point of care. And the people, before they go home, they see us. So much of our role is we are there to look at what has been done, the diagnostic part, what has been documented, and then we also look at what's been prescribed, and then we assess based on what also the particular patient has been taking. So it's like we do check and balance at the end of the day. So we also do what we call, you go back like 3 months back, whereby you need to check the patient's medical history and see if the medication that he's getting is already having it. So what you do in the process now, you take the medication, evaluate the prescription, then you now need to advise the patient on the medication that are referred. Ask the right questions, and also tell the patient the right answer, the right information, not to overload and not also not to give. So your counseling must also impel with what the doctor have written on their prescriptions, so that you don't give something that the patient feel like doctor said this, but now the pharmacist is saying this. And ask the right question also to the patient to say, what did the doctor say about the medications, etc. So did the doctor tell you which medication to use, etc., etc. So now, first and foremost is to define each drug. We have drug people now when they come to hospital, they have pain, they have hypertensive, some they have diabetes, etc., etc. So you need, as a pharmacist, simply you go there. These are your hypertensive medications. For instance, perindoprine. If you go there and you probably have a cough or you feel like you are unwell, it can be a side effect. But if you feel uncomfortable, please come back to the hospital and talk to your doctor as you go and they go and go. That's the part when you are dispensing. But also is to, also as a pharmacist, to ask the another question is, did you ever have any other problem with any other medication apart from what I'm giving you? And this is now where, as pharmacists, we must now reintroduce what we call referral. You know, like the doctor have said, they are different from moderate, medium to severe and whatsoever. As a pharmacist now, you need to assess. If the person say, for the past 4 months, I've been having this medication and I've been coughing, sometimes it might be tolerant, but it also disturbs a person's livelihood. You don't want to be at work every time you are coughing. So now you say, okay, to me, I feel like this is a bronchiopathy problem. Please, I will call the doctor, or I'll put a note to the doctors. Then you go back to the doctor and they can change. And I'll probably briefly also tell the patient what is available out there, so that the patient, when he goes there, is educated. And also sometimes as a pharmacist, another part which we need to play is to encourage patients to talk to their physician or to the doctors about their disease. So you must understand why you're having hypertension, what type of hypertension, diabetes, what to do, etc., etc. So that's the role of a pharmacist. And then also if there are caregivers that are around, also to remind them. There are certain medication that we feel like for instance, we have some medication like ibuprofen, for instance, whereby, yes, it's needed for pain, but we need also to cancel. This medication need to be taken with food, empty stomach, with water. Some of them are antibiotics like gasflovin, where we need to eat a fat meal so that the preservation can be well done. And then there's some like metronidazole, which have a metallic taste. So you still need to go through those ones so that the patient and the caregivers, they understand, so that the person who is at home have that supporting system to say, it's too metallic, and the patient say, but you remember the pharmacist said, it's how it is, there's no harm. I think that's our role as a pharmacist, and just to make sure that when we receive report from the patient of those adverse effect, adverse event, we assess the one, and then the same time as we are assessing, we report on those form that we get, and then when it's necessary, we refer and we educate. That's our role as a pharmacist.
Okay. Thank you so much, Mr. Itula, for painting that picture for us to realize that it's a holistic approach to the patient's healthcare and also medicine safety. Ms. Shimbulu, from a regulator perspective, a medicines regulator perspective, what is then your role in this regard, especially after going through the whole referral process at facility level? Where do you then come into the picture and how do you feature?
Okay, thank you, Ms. Weather. So from a regulator perspective, because the regulator has actually a mandate to ensure that medicines that are circulating on the Namibian market are safe, efficacious, and of good quality. But to zoom into the pharmacovigilance aspect, so we are the custodian of the data that is reported to us from the various facilities by healthcare workers or directly from patients. So what we do with this data is that we assess the causality of this adverse event, whether it is indeed related to the medicines that is being used by the patient. I think the definitions that have been previously elaborated on by Dr. Ngobe indicates that when it comes to the adverse event, I think an important point that I must highlight is that it occurs after the use of the medicine, but sometimes it's not necessarily because of the medicines. And that's where we come in. We need to assess that relationship. Yes. And then through that process of assessment and data analysis, we then can also generate a safety signal. It can give us an alert that we've been getting a lot of reports with regards to this, or we're getting serious side effects or adverse drug reactions with regards to this product. So usually we then have to make regulatory decisions with regards to the safety profile of the product, whether the benefit outweighs the risk. And this is the information that can then inform updates to the package insert of the product. In extreme cases, products can be removed from the market or can be withdrawn. and you might find that some adverse drug reactions affect certain populations. So basically, you then identify the population that is affected, and definitely the manufacturer has to intervene in ensuring that that information is publicly available to the user. I also just wanted to emphasize on the roles of the manufacturers and marketing authorization holders who are responsible for manufacturing the medicines, and also who has the authority to market the products on the Namibian market. So as per the Medicines and Related Substance Control Act, they have a mandate to ensure that they have a system in place. They should be reporting, they should be monitoring this product on the Namibian market. They should be informing us of any alert, and then regulatory actions can then be taken.
Okay, all right. Thank you so much, Ms. Shimbulu, for that. And I think what you've shared now from the regulator perspective and also from your experience in clinical practice, it really comes back to the theme that says how healthcare professionals and patients work to make safety work. We wouldn't be having these reports or these feedbacks on medication safety if it wasn't for our patients. So before we can continue, to our viewers that are joining us, our lines are open and you can contact us on 061 400 397. That's 061 400 397. And also for those that are joining on our social media platforms, you're welcome to go on the MICT YouTube and Facebook page for your comments and your questions. So we are opening up the lines now. Okay, we don't seem to have a caller yet, so then we can then proceed with our discussion. So back to Mr. Itula, I'm going to throw two questions to you here. So the first one being, how safe are the medicines that we are using that are available on the market, as Ms. Shimbulu has said? And secondly, why is the monitoring of the medication safety important? So are these medications safe, and how is it important, or why is the monitoring important rather?
Okay, thank you for the question. The medication, we can say the medication are safe so long as it's taken as is prescribed at the correct dose, at the correct time, with the correct meal as it's supposedly to be done. And on that one also, it also needs to be prescribed at the correct dose. We can give an example like in children, for instance, whereby doses need to be calculated per weight. We don't necessarily need to look at a kid and then look at to say, okay, this is 1.6 meters is probably now can able to take an adult dose, but we need to use the weight and calculate. So long as it's under the theme as a pediatric, we need to calculate that one. Then we can able to say the medication are safe so long as those aspects is taken in considerations. However, the risk of medication are still there. Remember, these are some pharmaceutical ingredients that are going in your system. So there are still some risk that is there. And that's now resulting in what we call pharmacodynamics in terms of the interaction between the body and the medication when you put them in. So there are still that room of to say, what are we doing about the risk? We know it's safe when it's done in the correct way, but those minimum risk, that's the one now where we come in to monitor. Because we know that even the manufacturer, the patient leaflet, it reported that there are certain aspect of 10% to 1%, 1% to 10%. And this is now depend on which medication we are talking about. For instance, paracetamol, for instance, it's quite one of the most safest drug. But there is a likelihood of abuse of paracetamol, especially when we look at the current turmoil where we're in from COVID, now we are in this poverty, etc., etc. So young people, they're also struggling with their life on their own. They tend to read and they tend to know that if you drink too much paracetamol, you might lose your life. But sometimes it's not the intention to kill themselves, but probably they want to punish the parents. So they take it on. So these are the risks now we come as healthcare professionals in order to assess, because it's a risk, not something that is granted, but you know there's a 1% chance that a normal individual taking his medication at the dose, the doctor has done his part, the pharmacist has done his part, the patient has done his part, but still there are those risks to come, like coughing that is associated with perindoprine, thrombolysis with warfarin, etc., etc. So those are now where we come in as healthcare workers, and we need to ask the right questions. We need to be friendly. We need to be empathetic to the people, and we need to be that person that people are willing to talk to us. An example I can say also, patients also have a group. There are certain patients that are very comfortable to talk to the nurses. There are those who are comfortable talking to the doctors, and there are those comfortable, they will leave all the nurses and leave the doctors, and they will come and they give all their problems to the pharmacist. So it's not as pharmacists to judge. Maybe the doctor or the nurse didn't. No, it's just to realize that each patient group, they have a way of whom they can able to give. So your job now as a pharmacist is to listen, and if you feel like it's severe or it's affect adherence, then you take a note and it's okay. Can you give me 2 minutes? You call a doctor and you discuss aside. Then the doctor probably say, okay, can you tell the patient to come back? And then you say, there's something I think that I hear from your history that I think the doctor may be not able to take note. I already discussed with the doctor. When you go there, he's aware of the situation. Please go through with him again so that he can intervene. So that's where we need now to remove those risks, but only if, and I can see this only if, as healthcare workers are user-friendly. Patients will never disclose their problem to us if we are hostile, but we need to be user-friendly, and we need to be open, and we need to give them privacy. Nobody wants to talk about, to do their laundries in the open. So privacy, so when the person starts like going, we go. Pharmacists were being taught to detect patients' problem without where patients say a word. So one patient will come and pointing here, but the medication that they're asking is probably for a foot. When you have that type of patient, call him or her aside and say, can you start over again? So that you can able to start over the queue and dilate. So that's where we can able to do the risk, and the rest become easier. And if the patient have a confidence on us that we can able to be open to listen to them, and I think the reporting of side effect can happen even at the ground level, at the clinic level, health center level, before even reach us to the hospital.
Okay.
Yeah.
Thank you so much, Dr. Itula. You've just encroached into my next question, but I won't pose it to you.
Yeah.
So my next question is from what you have mentioned, especially you highlighted the element of trust and confidentiality, and perhaps that is maybe one of the reasons as to why we're here today. And if we have to assess the reporting levels and how many reports we've received, maybe they're low, maybe they're high. Maybe they're high because patients feel that they actually have a say or they have a role to play in medication safety for themselves. So, Dr. Pandey, what are some of the possible risks or some of the possible factors that can negatively affect the reporting of ADRs? So we'll start with you and then I'll kick the ball over to Sister Kanjeke.
Okay, thank you so much. So I think what we have seen in practice, if the patient is first and foremost not even aware that they can actually experience side effects from the medication, when it happens, they may not actually be able to recognize some of them, and then they can ignore them until at a point where it's maybe lethal, yeah? But again, we see that there is a high number of patients that are seen by, let's say, a given clinician, you know, and those high numbers sometimes are a little bit difficult to then sit down with the patient, sometimes tease out, because some patients you actually need to probe. And I'm so happy how, you know, Mr. Itula mentioned the groups of patients. So you find that at the doctor level, the patient is so quiet, but then when they go to the other side, so then that's already a missed opportunity, yeah, to get the side effects of medication, because the patient maybe is intimidated by the doctor, or maybe the approach, you know, they feel like the doctor is not approachable. But again, when it comes to the time also to do it, you know, maybe it's at the state facilities most of the time. You find that you've got limited amount of time per patient because there is a queue out there. So that can also be a little bit of a difficult thing for the doctor then to report. But again, it also depends on what level of adverse effect is it, you know. And then I think at one point in time, it then goes on to the patient being able to report themselves, because we've got these e-platforms that the forms are on, and if the patient is able to actually be educated by the clinician, again, that can actually empower the patient. So I think it just goes on to sometimes the working environment, and also perhaps, maybe some remuneration can motivate, but at the end of the day, it goes on to sometimes the volume of the patients we see and the time to actually do it. So, yeah.
Okay. Okay. So just to hold that thought, Sister Kanjiki, we actually have a caller from Tsumeb. Caller, can you hear us?
Yes, I can hear you.
Yes, the floor is yours. Thank you so much for calling in.
Oh, thank you very much, too. Yeah, I just want to pose a question. It's not more on safety. It's just about the medication under prescription, especially from the state hospitals. And this question is directly to Mr. Nchove. Why is it that the state hospitals, whenever patients make their way to the hospitals, under whatever circumstances surrounding the illness, the Panado is the one to be given? That's my question. Panado, whoever is listening to me is in agreement with me. Why are the state hospitals just prescribing mostly Panado? Thank you.
All right. Thank you so much, Mr. Anytime. So that question was directed to Mr. Itula. So, Mr. Itula, the question is why is that whenever patients go to state facility, the first medication or one of the first medications that they receive for, as Mr. Anytime said, any ailment is usually Panado, which is paracetamol. So the floor is yours, sir.
Okay. Thank you for the questions. It's actually everybody's question, even myself sometimes. I question that one. It's actually, the best answer is to say paracetamol is one of the safest painkillers in children. And that also to go and say, and it's also, we have few options in painkillers when it comes to children per se, because the rest are this is what we call steroid ones, like the ibuprofens and the mefenamic acid, that we reserve for specialist kind of care in case of like when they have cardiac issues from surgeries, anesthesia, those type of things. But as much as we say paracetamol, I would like to ensure the Namibian population that in most cases, 99%, paracetamol do the wonder. And the reason is because it have a lot of properties. It works for pain, it works for fever, which we call pyretic in the modern things. And it have that the best taste to the kids that when you give to the kids take it off. And that's the reason why per our facilities, per our regulations, paracetamol is mostly the best drug. Because if you look at the mostly kids when they come to the hospitals, the first thing that parent does for them is fever. Fever. That's the most thing. Even if you go to hospital that are full at night, if you ask much of the patient, 99% will tell no. When I come home, the kid was doing very well during the day. Come around 7 o'clock, I take the fever. The kid is just burning. You understand? So there's no any other drug out there or medicine out there that can able to suppress fever other than paracetamol, unless now whereby if the doctor becoming to intervene and they realize there's an infection, whereby now you add an antibiotic per se. But paracetamol is one of I trust it. We have those questions, but I just feel it's a psychological aspect that we want to work on to say paracetamol is the best available painkillers to the kids and even to the adults. There are even some adults that they come and say, and the color, what I've seen also like the one that's available is like, if you believe like color coding now, we also try to go on a color, like we want paracetamol green, the green one, because most people believe that one works than the white one. And that's why you see most paracetamol in kids are normally green. And then there's the other one is strawberries, kind of orange. So long as the kid liking it, the psychological aspect of that paracetamol is to say it lower the fever, and by one time you give 1 spoon, the kid start running even at the hospital, even though when he came, it was depressed as such. So that's the reason why we cannot run away from paracetamol. And there's nothing out there that will be able to replace paracetamol when it comes to the kids. That's the only reason why we put it there. It's the most effective one. We just need as parents to believe in paracetamol, the same as kids believe in it when they take them.
Okay.
Yeah.
Thank you, Mr. Itula, for that. And I hope, Mr. Anytime, your question was answered. But please do continue to post in our social media platforms, and we will entertain those questions once we do have the chance to. So coming back to you, Ms. Shimbulu, from the regulator perspective, could you please just explain to us what is the role of your subdivision, which is the Therapeutic Information and Pharmacovigilance Center, in ensuring medication safety through the reporting of these ADRs? And also a very, very key important thing is, how should they report? Because as part of this Med Safety campaign, we're saying report, report, report. And the general public also needs to know what avenues are available for them to report.
Okay, thank you very much, Ms. Weather. Perhaps I could start by saying that safety monitoring of a pharmaceutical product should continue throughout its life cycle. And I just wanted to build on what Mr. Itula has mentioned earlier with regards to the safety of medicines. So it's worth noting that before a product can even be introduced on the market, there are processes that are in place that assess the safety and efficacy of a pharmaceutical product. So each product, after it has been tested preclinically, that's in animals, and then it undergoes the various phases in human studies, first in healthy volunteers and then in unhealthy, in the various phases. And throughout these processes or throughout these clinical trials, we gather more data on the safety of the product, although the safety profile at this point might be limited, but it's sufficient enough because we have a sufficient sample size to make a decision that this product is relatively safe and can therefore this data is submitted to a regulatory authority for review, and then after its review, it can then be approved for marketing authorization based on various aspects, including the safety. So when the product comes on the market, there is an established level of safety, and thereafter, we have to continue monitoring it. Especially if it's a relatively newer product, we still need to learn more about it. We continue following up on it. And this is where our division comes in, the Therapeutics Information and Pharmacovigilance Center. So it's responsible for post-marketing surveillance. So we are following up on this product on the market. We want to find out when it's now being used broadly in an uncontrolled environment, various populations, pregnant women who are not part of the clinical trials, the elderly, people with concomitant medication and comorbidities. We want to know how this medicine is behaving. So we collect this data, we make regulatory decision, as I've already alluded to. And with regards to strengthening systems, we want everybody to report. Our role is to ensure that there are systems. We support the systems that are in place for the various stakeholders to report. And how can people report? They can report directly to our center, that is the Therapeutics Information Pharmacovigilance, at info.tipc@mhss.gov.na. They can call us on 061-203-2406. But we always encourage that also they report to their healthcare provider so that they receive the management that they require, so that the adverse drug reaction is not only reported, but is also managed.
Okay. Thank you so much, Ms. Shimbulu, for that. So that's the center to which they can report, and that's to the regulator. Are there perhaps any other services that are available at the health facilities, Sister Kanjeke, perhaps?
Yes, we have a Gero state form, which we use as our tools to report. If in case of a patient have got any adverse drugs reaction, and after you fill up that form, you need to forward to the pharmacy, and that pharmacy need to forward to Ms. Shimbulu's office.
Okay.
Yeah.
Okay.
And before that, I also want just to emphasize for the green passport. There's also, it was our old system which we used to communicate with other. For example, I'm allergic to penicillin. In the state, we use our yellow passport or green passport. That one already communicate with the other. For example, I stay in Windhoek, I react to penicillin when I went to visiting health facility in Windhoek. I went to Swakopmund for the holiday. Then I get sick. My family rush me to Swakopmund Hospital. My passport already communicate with my colleague that no, this patient, whenever you give, don't give penicillin. That one is also one of them. And the other things, we really need just to educate our patient to report any change come to your body after you take anything. And we need to engage the patient so they must be feel-free to us to express their feeling and to tell us what is their problem. Through that, we need to be friendly to our patient. We also need to educate our patient. We need also to be counseling our patient that this medication, the idea is to help you. But in case, if this medication your body reacts to, you must come back to us. Thank you.
Thank you so much for emphasizing on that aspect of engaging with the patients really through counseling and through implementing certain elements of the human nature, such as ensuring that they can trust you as a healthcare professional, that their information is safe with you. So in order for a patient to come and report medicine safety, they need to first feel safe with you. And I think that is an element that has been emphasized through this talk. And it's also very important to say thank you for creating this awareness, not only on the systems and structures that are available for medication safety and some of the terms that we've heard, such as pharmacovigilance, adverse drug effects, and so forth. But it's good to know that there are these doors that the patients can come and knock on, whether it's at facility level and also contacting the regulator directly. So we're going to close off with some final questions. In light of the hashtag MedSafety campaign, what can be the involvement of other stakeholders? So we've mentioned the healthcare professionals, we've also mentioned the patients, but anybody else, what involvement can they have within this campaign? And from what you've all shared, you have made it known that this is just simply the campaign, but it's a proactive role in encouraging reporting or ensuring medication safety within your various cadres in your day-to-day job. So let's start off with Sister Kanjeke, and then after that, then you can also give your final remarks to the public. So how can they get involved, and what is the word or the main message that you want to spread from your side? So we'll start with Sister Kanjeke and then work all the way down the row.
Thank you again, Ms. Shiweda, for the opportunity. From my side, I really want to involve each and everyone in the whole entire Namibia nation. So they must be guardians for themselves, for their family. Whenever information what he have, he must share with the other. So everyone must really know what to do. Because I realize that sometimes you have a problem, but you really don't know where to take that problem. Sometimes there's also lack of equipment, like as I mentioned here, Jello safe form. It can be maybe other people like from the region. It's just the first time what they are talking about. But if we really share to each other, everybody must be very gentle. Know what to do if anything happened to her or to her family. Where to report, what to report. Thank you very much.
Thank you very much, Sister Kanjeke. Dr. Mpande, final words from your side, and what more can we do with already what's existing? What more can be done?
Thank you so much. So I think, we can break it down to the prescriber, the dispenser, and also the patients themselves, including now the relatives around the patients. So I think, we can be our brother's keepers. So medication is given for disease, but there are side effects that can occur. There are adverse effects that can occur. And as a medical doctor or you are a nurse in the ward, you can be able to also pick some of these things up even before the patient comes. Yeah, so that is at that level. And also just making sure, the right doses are given, right instructions are given to the patients. At our level, it can really help. And, at the level where now the dispensing is happening, we have, I've seen very good communication, especially at Intermediate Hospital Katutura, where it's a back and forth communication with the pharmacies, and that's really remarkable. So that can also help, to address that. And then when we look at the patients, the patients usually have got relatives around them. So I think that support system should continue to exist, because when you look at the adverse effects, most of them, it's extremes of ages, the young or the elderly. So we can also be out there to look out for this. And I had mentioned earlier that, there's also the e-platform, and it can actually be made known, to the patients, so that they can know that, you don't even have to sometimes go. If you are maybe too far from the health center, you can just go online and then you access and then you can report. So, yeah, so that's my word to the whole nation. Thank you so much.
Thank you so much. Dr. Redeemer, remind us to give you a call when we decide to run a national awareness campaign, because we will certainly need you. Ms. Anna, under 60 seconds, what is your expectation? What is your plea to the nation?
Thank you, Ms. Bella. So pharmacovigilance is everybody's responsibility. So I really just want to encourage everyone to be involved and to just bear in mind that that one report makes a huge difference. It's not just individual report that plays no significance. We look at each one of the reports, we compare if this report is also existing everywhere. So always remember that your report count. And I like what Dr. Ngobo said, that there is an e-reporting which is available for the general public. You just go on our website. If you go on the social media, we are flooding information on the campaign. The e-reporting link is also available, it's accessible. So be involved.
Okay. Thank you, Ms. Shimbulu. Mr. Itula, 5 seconds. What are your final words?
Thanks. Mine is just to go again to say, as much as I'm a pharmacist and as a healthcare professional as such, that the role of a pharmacist added to the role of a nurse, added to the role of a medical officer, which is a doctor they call. We are normally there to help the patient. And another aspect is like, as a patient at home, we must also probably stop sharing medications, because that one also contributes to the risk that normal people react, because those patients was meant for A, now became to death. So for that one, I'm saying like, for this one to work, we all need to get involved, report to all access point, pharmacy, hospital, clinic, to every healthcare workers that's available to us. Thank you.
Okay. Thank you very much to the panelists for this very enlightening, information-filled session. And thank you so much to the viewers that have joined us today. So if you're going to participate in Med Safety Week, then you should comment on every social media platform, hashtag Med Safety Week campaign, and we will be able to see the pop-up and see your involvement in ensuring your medication safety. With that said, I thank you and good day.